Hello, my name is Chastity Rosario, and I'm going to be discussing the insertion and removal of an RGP lens, otherwise known as a rigid gas permeable lens. First of all, we're going to make sure we always start off by washing our hands, get under those fingernails, make sure your hands are completely free of any sorts of debris. After that, you're going to want to dry with a lint-free towel. And then grab your RGP lens, place it on the palm of your hands, and we're going to go ahead and rinse that lens. You can rinse the lens with saline solution or a multi-purpose solution. After it's thoroughly rinsed on both sides, then we can go ahead and inspect the lens. Grab the lens, put it on your pointer finger, and start to inspect it thoroughly. You're going to want to inspect for any cracks, any chips, any deposits, any debris. After we've thoroughly inspected it, now we're ready to go ahead and actually insert the lens. With your non-dominant hand, you're going to go ahead and immobilize that eyelid. You can hold the bottom eyelid and the top eyelid. After you have a firm grasp of your eyelid and it's completely immobilized, we're going to go ahead and place the RGP lens directly on the cornea. So just go ahead and tap that pupil as best as you can. And then when it comes to the wearing schedule, you're going to wear your rigid gas permeable lenses for 2 hours the first day. Then after that, 2 hours and 2 hours additionally every day. And some sort of solutions that you can use at the house can be either an oxidative system, which you can use the tablet, or you can use the oxidative system that has a platinum disc on the actual system to go ahead and disinfect. Preferably, you want to go ahead and allow this to disinfect thoroughly throughout the night, because in the morning, the system will be thoroughly cleaned and clear and your lens will be ready to go, because after several hours throughout the night, it'll eventually go from that solution into water. And another solution that you can use are the Boston line for cleaning, rinsing, and disinfecting. The Boston Simplex is about a 3-in-1, so if you want to just go ahead and purchase that. Do's and don'ts when it comes to storage: you do not want to store it with saliva. You do not want to use tap water. You also do not want to use the DMV. The DMV is to go ahead and remove that lens only in the case of an emergency. But if it's not an emergency, you do not want to use the DMV. The replacement schedule for your lens will be every year, annually. And now we can discuss to go ahead and remove that lens. You have the scissor technique and the lid margin technique. For the scissor technique, you can just go ahead and grab the side of your eye, pull towards your ear, and you can blink while looking nasally to your nose, and the lens should go ahead and fall out. If you're having difficulty, the other method is the lid margin method, which is pretty much like popping a pimple. You're gonna grab your hand, grab the lower lid, your other hand, grab the upper lid, and you're just gonna go ahead and push. And as you're pushing, that lens should go ahead and just slip out. If you have any redness, irritation, discomfort, or pain of any sorts, please go ahead and speak with your doctor immediately and directly. Again, any redness, irritation, discomfort, or pain, please see your doctor immediately. And important as always, make sure that you have a pair of backup spectacles. You never know what could happen with your lens, and you still need to carry a pair of glasses with you at all times. Do you have any questions? Thank you.